Okay, next case here, we have a 32-year-old male physician who's brought to your clinic by his wife. He was recently diagnosed with paranoid schizophrenia, and his wife tells you that he's become increasingly dependent over the last 2 months and is now unable to care for himself. He continues to hear internal voices which are telling him that the police and the CIA are after him. On physical examination, he appears disheveled. Although he is cooperative, you notice that he has a flat, blunt affect. Currently, he is being treated with typical antipsychotic medication. You assess this patient's need for an inpatient evaluation. You decide to switch him to a medication that will treat both the positive and negative symptoms of schizophrenia. Although you inform him and his wife that the medication may cause a granulocytosis. So let's see what this is. Well, these are the atypical antipsychotic agents. So think of risperidone, olanzapine. Olanzapine is Zyprexa. Mechanism of action: they block the serotonin 5-HT2 and dopamine receptors in the limbic system of the brain, thereby decreasing the response of the postsynaptic neuron to dopamine and serotonin excitation. Clinical uses: they're used to treat the positive and negative symptoms of schizophrenia, bipolar disorder, and other psychotic disorders. Can also be used to treat delirium. Side effects: mild weight gain. You have to watch that. Hyperglycemia. Clozapine can cause mild leukopenia and granulocytosis. And therefore, patients using this medication require weekly monitoring of their white blood cell count. So I have a patient at the moment in my psychology clinic who is taking Zyprexa, and he is also seeing a psychiatrist, but I don't think his doctor is checking his white blood cell count, and he's getting bigger. He seems to be hyperglycemic, and he's very slow. I don't know if that's the effect. It says side effects: mild weight gain, mild hypertension, Parkinsonian symptoms. Anyway, so note the atypical antipsychotic medications have fewer extrapyramidal and anticholinergic side effects than the typical antipsychotic medications. So main points here: positive, negative symptoms of schizophrenia. Mild weight gain is a worry, and some typical drugs: olanzapine, risperidone, clozapine, and let's remember this one.